Hello, my name's Jan Rice, and Gary asked me some time ago, I hate to admit, to do another short video on antimicrobials. I'm sometimes known as the betadine queen because I use a lot of it and haven't really stopped using it since my nurse training days. How I use it is different to my nurse training days though. So let's start with antimicrobials. Antimicrobials is the umbrella term that will cover antibiotics, antiseptics, antivirals, antifungals. So when do we use these? Well, the big issue is that wounds that are left open for quite some time will contain a number of organisms. Some are not harmful and others may be harmful, and certainly others may slow healing. So what we're really wanting to do is make sure that the host is stronger. So we make our host stronger by good nutrition, emotional support, good sleep, all of those good things to build our host up. Then the other part of the equation in microbes getting a hold of us is the strength of the microbe itself. So we need to knock some of these off. And in order to do that, we need to use either antibiotics or antiseptics, or antivirals or antifungals. So we want to be guarded when we use antibiotics because we know we're not making any new ones, and there is antibiotic resistance out there. We have lots of safe antiseptics that we can use, and we should consider these. I am known as the betadine queen. I use a lot of it. I don't use it like when I was training many years ago. So 4-hourly betadine gauze packs, I don't do that. But I do clean the skin with povidone iodine. I do use povidone iodine in wounds that have yucky exudate, and we should always be looking at our exudate. Remember that normal exudate is serous. So you got anything on your pads that you remove and it's pretty foul, then you've got microbes in there. Now, people who don't like povidone iodine, it's because Alexander Fleming, the father of antibiotics and antiseptics, he said that all antiseptics kill living cells. And he's correct. But if you don't kill the bugs will kill you, and then there's no point in worrying about living cells. So we do have to knock some of these bugs off. So I think judicious use of antiseptics is a good thing. Now, there are lots of wound cleansing antiseptics out there now, and I would encourage you to have a look at those. The reason that I've stayed with povidone iodine is because there is no resistance to it. Yes, there are people who say, I'm allergic to it, but many of those people are older and it was used in a different format. It was a tincture of iodine. Today, the povidone iodine is a different formulation, but I wouldn't say that there are not people allergic to it. There are some. And some do have a bit of discomfort. Of course, chlorhexidine is also used, and it has a higher level of allergy. So hence why I go for the povidone iodine. But there are many antimicrobials out there. There are many antiseptics out there. The most important thing is that you ensure that you are in control of the microbes in the wound, not the microbes. Thank you, and I hope that has been of some help. Bye.